Post-traumatic stress disorder, also known as PTSD, is an anxiety disorder caused by experiencing or witnessing something traumatic. After World War I, it was known as shell shock, and then combat fatigue after World War II. However, PTSD does not just affect those who have gone to war. Any traumatic experience can cause somebody to develop PTSD. People who have PTSD have distressing thoughts and feelings about the traumatic event. Sometimes they may experience flashbacks, nightmares, and emotional detachment. Other symptoms are hyperarousal and hypervigilance. PTSD can have a negative effect on relationships and a person's self-perception. Sometimes avoidance behaviours develop. PTSD does not always develop straight away. Usually symptoms arise within 6 months of the event. Psychological therapies are the main form of treatment for PTSD. Trauma-focused cognitive behavioral therapy, or CBT, is one example of this. The goal of trauma-focused CBT is to change the way the person thinks about their traumatic experience. Eye movement desensitization and reprocessing, or EMDR, is another treatment that can help PTSD sufferers. Sometimes medication is prescribed if symptoms are persistent. If you'd like to learn more about PTSD, watch our program Post-Traumatic Stress Disorder, a 30-year case study. The link is in the description box below. In the initial stages of treatment, a comprehensive assessment of symptoms will be carried out to determine a patient's individual needs. This is typically conducted by a GP, but patients who experience severe symptoms of PTSD for more than 4 weeks will be referred to a mental health specialist. Watchful waiting is a process of monitoring patients with mild cases for a few weeks to ascertain whether their symptoms are improving or worsening. According to the NHS, 2 in every 3 people who develop problems after a traumatic experience get better within a few weeks without treatment. For PTSD that requires treatment, psychological therapies are often recommended first. This may involve psychological therapy coupled with medication for severe or persistent cases of PTSD. There are 3 main types of psychological therapies used to treat PTSD. Cognitive behavioral therapy, or trauma-focused CBT, is used to help patients reconcile with the traumatic event. A therapist may ask the patient to confront the memory by thinking about it in vivid detail. The therapist then helps the patient cope with the distress and identify negative thoughts or misrepresentations they may have about the traumatic experience. The patient may also be encouraged to incrementally re-engage with activities they have been avoiding since their experience, for example, driving a car following an accident. Eye movement desensitization and reprocessing, or EMDR, is a relatively modern treatment designed to reduce symptoms of PTSD. A patient makes side-to-side eye movements, usually following the movements of their therapist's finger, while recalling the traumatic incident. Sometimes the therapist may tap their finger or play a tone. It's not fully understood how EMDR works, but it can help to change a patient's negative thoughts about their trauma. Group therapy can also be recommended for PTSD. Some people find that it helps to speak about their traumatic experiences with others who also suffer from it. It can help a patient find ways to manage their symptoms and understand the condition. Medication for PTSD involves a variety of antidepressants, such as paroxetine, sertraline, mirtazapine, amitriptyline, or phenelzine. These medications will only be administered for patients who choose not to undergo psychological treatment, or for whom treatment has little or no benefit, as well as patients with underlying health conditions such as depression, or patients who are at risk of experiencing further trauma. For further information on PTSD and treatment, please visit our website and take a look at our 30-year case study on the subject, which we have linked below.